All right, let's dive in. Today, we're talking about tiotropium, a medication that's a real game changer for people with chronic lung conditions. We're going to break down how it works as a 24-hour guardian for your airways. For most of us, breathing is just automatic. We don't even think about it. But for millions of people, every single breath can be a struggle, a conscious effort, and a daily fight. So what's actually going on inside the lungs that causes this constant battle? Well, it boils down to something called chronic airway constriction. It's like the areas are just stuck in a permanent state of being squeezed. And here's the scientific term for it, bronchoconstriction. Basically, your nervous system is sending out a chemical messenger, it's called acetylcholine, that's telling the muscles around your airways to squeeze tight. Now, in a condition like COPD, that signal is basically on a constant loop. It's stuck in the on position. And that's what causes that long-term narrowing that makes breathing so tough. Okay, so if the problem is a signal that's gone rogue, then the solution has to be a way to block that signal, right? Well, that is exactly what tiotropium is built to do. It's all about unlocking those airways. Let's use an analogy here. Think of it like a lock and a key. That squeeze signal, acetylcholine, is a key, and it's trying to get into a lock on your airway muscles to turn it and make them tighten. Tiotropium comes along, and it's like a different key that fits perfectly into that same lock, gets in first, and then just stays there. It jams the lock, so the original squeeze key can't get in. And with that signal blocked, the muscles never get the message to tighten up. So what do? They relax, and the airways open up. The result of all this is a process called bronchodilation. It's just a fancy way of saying your airways are widening. But wait, there's more. Tiotropium actually gives you a 2-for-1 benefit. It doesn't just open the airways. It also helps cut down on mucus production, which is another huge problem in COPD. So you get wider airways and less skunk blocking them. That's a massive win for airflow. Now, blocking the signal is great, but here's what truly makes tiotropium a game changer. It's how long it keeps that signal blocked. This is what transforms it from a temporary fix into a true, long-lasting maintenance therapy. And this is the magic number, over 24 hours. That's right, tiotropium latches onto those receptors in the lungs so tightly that one single dose gives you continuous, around-the-clock protection. We're not talking about just a few hours of relief. We're talking about waking up and going through your whole day and even into the next morning with sustained support for your breathing. So let's walk through how a single dose works. In about 30 minutes, it's already starting to improve lung function. Then, somewhere between 1 and 3 hours, it hits its peak power. And after that, it just keeps on working, holding those airways open for a full day, all the way until it's time for your next dose. This brings us to something that is absolutely critically important to understand. Tiotropium is a controller medicine. You take it every single day to prevent symptoms from happening. It is not a rescue inhaler. If you have a sudden asthma attack or a breathing crisis, you need something that works in minutes, not hours. Tiotropium is the slow and steady guardian. It won't save you in an emergency. Confusing the two can be incredibly dangerous. Okay, so we know what it does, but who is this medication actually for? And how do you get it into the lungs where it needs to do its job? Well, its main job, its number one use, is as a maintenance therapy for COPD. It's a cornerstone of treatment. It's also approved as an add-on therapy for some people with asthma, specifically for patients whose symptoms just aren't being controlled by their other daily medications. Now, how do you take it? It's inhaled, and there are 2 main devices. First, you've got the HandiHaler. It uses these tiny little capsules filled with a dry powder. You pop one in, pierce it, and then take a deep, strong breath to pull the powder into your lungs. Then there's the Respimat. It's different. It releases this really slow-moving soft mist. For some people, coordinating their breath with that gentle mist is a lot easier than taking that big, forceful inhale needed for the dry powder. All right, with any medication this effective, it's just as important to understand the safety side of things as it is the benefits. So let's talk about the side effects and the things you need to look out for to use it safely. So what should you really be on the lookout for if you're taking tiotropium? We can kind of break this down into 2 groups, the common stuff and then the less common but more serious things. So because this medicine works right there in your lungs and throat, it makes sense that the most common side effects are local. Dry mouth is by far the one people report the most. You might also see things like a sore throat, maybe a cough, or some sinus issues. The good news is these are generally pretty mild and well-known. Okay, now for the serious list. This first one is rare, but you have to know about it. It's called paradoxical bronchospasm. It means that in a few cases, right after using the inhaler, the airways can suddenly tighten up instead of opening. If that ever happens, you stop using it immediately and call your doctor. The other things on this list can happen if the drug has small effects beyond the lungs, so they're all things to discuss with your healthcare provider right away if you notice them. And that leads right into who needs to be extra careful with this medication. If you have narrow-angle glaucoma, there's a chance it could make it worse. If you have an enlarged prostate, it might make urination more difficult. And because the little bit of the drug that gets into your system is cleared out by your kidneys, anyone with kidney problems needs to be monitored closely. So let's zoom out and put this all together. What's the big takeaway here? Tiotropium is so much more than just another pill or puffer. For so many people, it's a genuine partner in managing their breathing, day in and day out.
You know, this quote really nails it. The ultimate goal here isn't just about tweaking a number on a lung function test. It's about reducing those scary flare-ups. And more than anything, it's about enhancing quality of life, giving people the freedom to do more, with less shortness of breath holding them back.
So I'll just leave you with this question to think about. How can really understanding what your medication does, why you take it, and what to watch for change everything? It moves you from just being a patient to being an active, empowered partner in your own health. It's that knowledge that makes all the difference.